How do doctors interpret borderline PSA levels? When it comes to borderline PSA levels, which are typically between 4 and 10 nanograms per milliliter, doctors take a careful approach. They consider various factors to evaluate the risk of prostate cancer and determine the next steps. Prostate-specific antigen is a protein made by the prostate gland. Elevated levels can indicate prostate cancer, but they can also arise from benign conditions like prostatitis or an enlarged prostate. A PSA level in the borderline range is often referred to as the gray zone. Research shows that about 25% of men with these levels may have prostate cancer if they undergo a biopsy. This means that while there is an increased risk compared to lower PSA levels, most men in this range do not have cancer. Doctors also look at a patient's age and prostate size when interpreting PSA results. For instance, a PSA level above 2.5 nanograms per milliliter may be concerning for younger men in their 40s and 50s. In contrast, for men in their 60s, a level above 4.0 nanograms per milliliter raises more alarms. Larger prostates can produce more PSA, so doctors adjust their interpretations based on these factors. To enhance accuracy, doctors often assess the ratio of free PSA to total PSA. A lower percentage of free PSA is linked to a higher risk of cancer. For men with borderline total PSA levels, measuring free PSA can help determine if a biopsy is necessary. Monitoring PSA changes over time is also crucial. A rapid increase, known as PSA velocity, can be a red flag, even if the absolute PSA level is borderline. For example, an increase of more than 0.35 nanograms per milliliter within a year may prompt further evaluation. If a PSA level falls into the borderline category, doctors might recommend repeating the test to confirm the results. They may also consider newer blood or urine tests and imaging techniques, such as multiparametric magnetic resonance imaging of the prostate, to better assess cancer risk before deciding on a biopsy. Shared decision-making is an essential part of this process. Doctors engage patients in discussions about the benefits and risks of further testing, taking into account individual factors like age, family history, race, and overall health. It is important to note that there is no absolute PSA cutoff that can definitively diagnose or rule out prostate cancer. Some men with PSA levels below 4 nanograms per milliliter may still have cancer, while others with higher levels may not. PSA serves as a screening tool to guide further evaluation rather than a standalone diagnostic test. In summary, doctors interpret borderline PSA levels by integrating the PSA value with patient-specific factors, additional tests, PSA trends over time, and advanced imaging or biomarkers. This comprehensive approach helps balance the need for early detection of prostate cancer with the desire to avoid unnecessary biopsies and overtreatment. Individual clinical judgment and patient preferences play a significant role in managing borderline PSA results. Always consult a healthcare professional for personalized advice regarding PSA levels and prostate health.